So this is my setup for my modified knots test. So I have my conical tube, my blood sample, my formalin, and my sterile water. So I'm going to need 9 mils of a 2% formalin solution. So I have a formalin here that's 10%, and I'm going to dilute it with some sterile water. So this is 7.2 mils of sterile water. And 1.8 mils of formalin, make a 2% solution, 9 mils of it. I need 1 mil of my anticoagulated blood. And just gently invert this a few times so that it's mixed thoroughly. Carefully. Alright, so I'm going to go put this in my centrifuge. So I need a ballast tube again, just like with my fecal sample. So I'm going to fill it to 10 mils so it's evenly balanced. Either side of my centrifuge. 1500 RPM for 5 minutes, and then we'll come back. So my sample's been spinning for 5 minutes here in my centrifuge. So you can see my pellet. It's pretty small, but you can see it right there on the bottom corner. So I'm going to pour off my supernatant into this container to dispose of later. I want to get all of it off.
We don't yet. We're working on it, so hopefully soon.
All right.
But right now we don't. So we usually recommend that or tops. The drafting of methylene.
This is my new methylene blue, which will stain my microfilaria blue if they are present. 1 to 2 drops. It's a hearty drop, so we'll stick with 1.
Yeah.
We're just gonna
So they
mix
do
my pellet, my stain,
but that's also an
my
option.
pipette, and then take my 1 drop sample.
Yeah,
on
yeah,
my
no, that
clean
would
slide.
definitely be the next step, but like I said, it's completely up to you on where you want to
Cover with a clean
but I would definitely do it if by tomorrow.
rubber slip.
Still.
There we go. To the side. Here is my slide. So we're going to look under the 100X. So microfilaria are the circulating
You're welcome.
heartworm in the peripheral blood. So that's what we're looking for in our microscope here. So they're going to look like basically little blue worms, which you're going to see. So by using the centrifuge and the new methylene blue, it's supposed, with the formalin, it's supposed to lyse off the red blood cells and concentrate any microfilaria if present. And the stain will stain them blue. So it should be pretty easy to spot if they are present. So I'm just going to keep moving through my microscope here so you can see. Down to 100. So mostly I'm seeing some lightly stained cells, but nothing that looks like little blue worms, which is what basically you are looking for. So this is my setup for a simple fecal float. So I have my stuff I'm going to need here. This is my actual fecal sample, my fecal analyzer, commercial fecal analyzer that we're going to use here, my clean slide, and my glass cover slips. My fecal float medium that we're going to use is zinc sulfate. It's a pretty commonly used one. It's a pretty simple process. I'm going to use my blue insert here on my commercial fecalizer. Grab a sample from this fecal sample. Alright, you can see my fecal sample in there. Put it back into my analyzer cup. So we're going to fill this halfway with our medium. About halfway. agitate it just a little bit to encourage the ova to separate from the fecal material. It's good. Now we'll fill it the rest of the way until we have a meniscus at the top of the analyzer.
No.
Alright, so we're nearing the top, so we want to have a nice little meniscus here at the top without overfilling. A little bit more. There we go. So now I'll place my cover slip on top and let that sit for about 10 to 15 minutes. Hopefully here. There we go. So that's going to sit for 10 to 15 minutes. So my cover slip's been sitting here on my fecal analyzer for about 10 to 15 minutes, so I just carefully take it off. Place it on my clean slide here, and then look at under the microscope under a 10x and a 40x. This is my fecal flotation with centrifugation set up. So I have my supplies here. I have my conical tube, my funnel, my gauze sponge, my fecal sample, my zinc sulfate flotation medium, and just my cup to mix my feces in. So I'm going to fill my cup with some solution. Grab about 2 or 5 grams of my fecal sample, which is about the size of the tip of your thumbnail, a little more than that. And we'll mix this together. Sample is pretty well mixed. So I'm going to use my gauze sponge to strain my sample through my funnel into my tube. So we have a fixed head centrifuge here, so I'm not going to fill it all the way to the top and create my meniscus yet. I'll do that afterwards to apply my cover slip, because we don't have a we have a fixed head centrifuge here. So I'm just going to fill my tube about 80% of the way. 80–90%. Perfect. That'll work. So I'm going to go centrifuge this in my centrifuge for about 5 minutes at 1500 RPM. We'll go back. So I'm going to centrifuge my sample. So here's my sample. I'm just going to fill an empty conical tube with an even amount of ballast so that my centrifuge spins weighted properly. So I'll let it about to the same level. This is my fixed centrifuge, opposite from each other, so it spins balanced at 1500 RPM for 5 minutes. So I'm going to turn that on. So my sample is done at centrifuging. You can see my sediment here at the bottom, which means centrifuge. So I'm going to put it back in the rack here and top off the rest of my tube with my zinc sulfate solution till I make the meniscus.
Yeah.
Alright, so top off till I have a meniscus at the top of my, there we go, the top of my tube. Place my glass cover slip on here because I had this fixed head and this is going to have to sit here for about 10 to 15 minutes before I examine it under the microscope. So place that there, and 10–15 minutes, then we'll place it on a slide and look under the microscope. So my sample's been sitting for, my cover slip has been sitting on my sample for 10 to 15 minutes. Just carefully remove it, place it on a clean slide, and now I can look under my microscope. My direct smear, it is the easiest and the simplest of all of the fecal setups. However, it can miss things because it's a very small sample size, and you can see debris in there that can be mistaken for parasites. But it's a pretty simple one. Here's my tools that I need: my clean slide, my cover slips. This is just some saline, my wooden applicator, and my actual fecal sample. So you're just gonna, dropped it, dip your wooden applicator into the fecal sample. Only a small amount of feces should adhere to the stick. We're just going to do a drop of saline on my slide here. There you go. And you're just going to mix your fecal sample in with your saline. A common mistake is to make the smear too thick, so you can't actually see through it. It should be pretty finely seen. A good trick is to make sure you can still read words through your smear, which you can easily in this case, so that it's not too thick, so when you're looking under the microscope, it's not hard to see through. And you're just going to place a clean cover slip on top of my smear and look at it under the microscope. Once again, most commonly 10x and 40x is used. So this is our setup for a fecal sedimentation. We have a few more things we need for this one versus our simple fecal flotation. So this one, obviously we need our fecal sample. This is our small sample of water, our cup, our conical tube, our tongue depressor. I have a little funnel here to make it easier to strain my sample, and then a gauze sponge to strain my sample through and cover slip slides. So I'm going to mix with a small amount of water in my cup here, about 2 grams of feces, which is about the size of your thumbnail. I'm going to use my tongue depressor here. Grab my fecal sample. So we're going to mix this well. That's pretty well mixed. Alrighty, so there's my conical tube. I'm going to use a funnel just to make this a little less messy and easier. There's my gauze sponge. So we're going to strain this from my gauze sponge into my tube carefully. So we're going to let this sit for 20 to 30 minutes. You can also centrifuge it, but we're going to let ours sit for 20 to 30 minutes. So my conical tube has been sitting for about 30 minutes, so I'm going to take my pipette and pull off all of my top section of my sample. You can see my sediment there at the bottom. I'm going to try very hard not to disturb it. You can pour it off, and in this case I'm going to use my pipette, so hopefully they won't disturb it at all. So I'm just going to pipette off all of my top fluid without disturbing my sediment. You can see all my collected sediment at the bottom. So I'm going to take a sample from the top of my sediment, put it on my slide. Sample from the middle of my sediment. So we go a little further down. There we go. A little thicker. And then a sample from the bottom. So just cover them with glass cover slips, one each. Bottom, middle, and top. This is my free catch sample on a dog, so you do want to catch your free catch sample first thing in the morning. It's when the urine's most concentrated. However, owners tend to be able to have to catch it whenever they can. Urine's only good for about 30 minutes, maybe an hour at most, out of the refrigerator before it starts to be affected and have bacterial growth just from being at room temperature. So you need to get it in the fridge and you can refrigerate it for testing for about 6 hours. and then after that, it's no longer very useful. So urine testing is a pretty quick process. So we're going to catch a midstream sample because you don't want to catch any bacteria that might catch on its way out of the urethra. Ideally, if you can, you would scrub either the prepuce or the vulva, just so that you can reduce the amount of bacteria. We're going to turn the corner here and catch our midstream sample. Boys, you can see it's been peaked a little bit, so I'll just catch the midstream sample. You can see my urine in my ladle. So you can use any kind of a ladle or any kind of a tool in order to catch a free catch sample. It's not going to be sterile, but it can be useful. This urine's pretty concentrated. Looks like basic canine urine, not cloudy or anything. My cystocentesis on a dog. This is Ziva. She came in for some urinary signs. So cystocentesis is best for culture and sensitivity because it's the least chance of bacterial involvement, but must be a palpable bladder, which this dog does have. We're going to put her in the trough. Sweetie, feet away. That girl. So there's a couple different ways that you can get a cystocentesis sample. You can just isolate the bladder and stick. You can do a blind stick, which is basically an anatomy stick. So you're just inserting the needle where the bladder usually is. Those are both come with risks of lacerating the bladder or having issues. So in this case, I'm going to use my ultrasound to do an ultrasound guided. So I did prep her stomach with a little bit of alcohol, as you saw, as well as put a little extra alcohol for my ultrasound to be able to see. This is my fresh, clean syringe with my 22 gauge, 1.5 cysto needle, so it's a longer needle. I'm going to use my ultrasound. So right there, that black area is liquid, which means that that's her bladder and that's urine. So I'm going to take my cap off. All right, everybody, we're going to do a little stick. So I can see that I'm in the bladder. You can see my urine in my syringe. Release pressure off the plunger and come out. So I'm going to cap that. Sample. You want to use a new large bore needle to put your sample into your tube to prevent any bacteria from the needle inserting to the skin. So I'm going to put it through my tube here. So this urine's pretty concentrated and clear, pretty normal for a canine urine sample. So this is catheterization of a male dog. This is Castiel. We're getting a urine sample. This is the middle of the road in terms of cleanliness. Free catch is the dirtiest version of getting urine. Cystocentesis is the cleanest towards me. 2 and 3. And catheterization you can use for culture and sensitivity, but it does have some bacteria involvement. So I'm just going to measure really quick my urinary catheters just past the hip. So you just follow the path of the urethra. He's a pretty big guy, so we're basically going to put it in almost all the way, just about 1 inch or 2 from my top. So this is my cleaning of the penis. I'm just going to have my assistant here extrude him. I'm just going to clean the tip, a little Chlorhex, non-alcoholic, because that would burn. These are my sterile gloves that I'm going to open. This is my sterile lube I'm going to place on here. Touching anything. Beautiful. So there's a couple different kinds of catheters. This is a red rubber that we're going to use. This is a Foley with a balloon that can stay in more permanently. Those are open-ended tomcats. Those are often used for unblocking cats. But we're going to just place a red rubber because it's just a momentary placement just for a urine sample. So I'm just going to put on my sterile gloves.
All these things, like, this is, so schedule, this is boarding, you can ignore that, and just wait for current patients. This is to see where their bill is currently at, so any unposted charge fees, that's...
Alrighty, so I'm just going to ask my friend Tammy here to open up my catheter and hand it to me plainly, so I stay aseptic.
It's okay, guys.
Perfect. I'm just going to put this in my sterile lube. So like I said before, with measurement, we should be going basically all the way in. And then I'm just going to need you to hand me my syringe when you're done, Tammy, so we don't need to grab it right now. It's right here. And she's going to hand me that syringe as well. So basically, you're just going to stick it into your urethra.
You were asking if there's a list of everything, that's actually how you look at it. So you can see where we have anesthesia, where we have drainage materials.
It'd be a pretty smooth and simple kind of process. Basically, just feed it in.
So yeah, you can look at
into
what
the
do we have
bladder.
for injectables, what do we have.
Usually, you know you're in. You get a nice little rush of urine.
And then this is just a diagnosis list, so should I be putting diagnoses in for each?
Yep, so you can see my urine coming out the tip. She's gonna hand this to me cleanly. So you're going to disregard the first couple of mils when you do catheterization because of any bacteria that could have made its way into your sample by passing the actual catheter itself. So this is my sample I'm going to take. So I'm just going to clamp this off and pull it out. Good boy, buddy. So I no longer have to worry about being clean because I have my sample here. So I'm going to touch my tube, put it in my tube. So this is a little bit more dilute than the cystocentesis sample, but still pretty concentrated, clear. Looks very normal. I'm sure his urine-specific gravity is fine. So I'm going to do my ear swabs for ear cytology. This little guy is Colby Jack or CJ. He has been scratching at his ears. He is an indoor-outdoor cat, mostly lives in a barn. So it's entirely possible he's got something like ear mites or some sort of an ear infection going on. So we're going to do some swabs. I have all my stuff here for me, some clean cotton swabs as well as my slides. Ideally we'll do 2 slides per ear. You do often just go ahead and check both ears even if they come in with symptoms only on one, because you'd hate to miss an ear infection on the other side that's kind of brewing underneath the surface, and you want to make sure that you're not over treating. If there's no signs of infection in the other ear, then you know you don't have to go ahead and treat it. So I'm going to label my slides here, left on 2 of them with just a nice big old L and R on the other 2, so I don't mix up which side. And we're going to go ahead and swab. So this is his right ear, even though it's on my left side. So you're just going to take a little swab from the ear canal. You can also do it through an otoscope. You don't want to go too deep because you can damage the eardrum or the ear canal if you're too rough. And you just get yourself a little sample. You're going to roll it. This is his right. Roll it out here onto my slide. You can see the little sticky gooness on there.
We got a buggy.
We'll get another. I know you're a good boy.
Oh, I know, baby.
Good boy for living outside.
Boy.
We'll roll that on there.
Yeah, so
So that's his right.
one on your
Now we'll do his left. Just the one I think he's been hitching more at.
but
I know, buddy. You're not go big.
okay.
He's got pretty clean ears for a little outdoor guy. Roll that onto my slide.
He's purring.
He's a nice boy, he is. And one more.
There's a good kitten.
Alrighty, Mr. Shake, shake,
Good
shake.
job.
Alright, so now I have my slides. I'm going to go to the lab. So I have my 2 slides, one from the left and the right over here that I'm going to just do a drop of mineral oil and a cover slip on, and then my 2 over here that I'm going to stain. So these are my 2 that I'm going to look at with just low light and low microscopes, just a drop of mineral oil and a cover slip over for both. So that's one prep for one set of the slides. And then these are my other slides that I'm going to just stain. So we have diff quick stains here, a rapid diff. We do have a set of dirty and a set of clean. You never want to put anything like ear slides or vaginal slides or fecals or anything like that in your clean. This should be only for your blood, because you don't want to put things like yeast and bacteria and things like that into those stains. So I'm only going to use the dirties. So the diff quick staining process is pretty simple. It's basically 10 to 12 seconds in each one, 1 second per dip, so you're basically doing 10 to 12 dips. So here's my first one, so I dip it in, 1 second, 1 Mississippi, 2 Mississippi, 3, 4, 5, 6, 7, 8, 10. A lot of the excess is just kind of drip off. Into my next stain, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. The excess drip off into my last stain, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then this will just air dry. You can heat fix your smears before you put them in here if you would like, briefly, but it's not necessary to do it in order to get a good look. So this is my stain slide that we just did in the Dick Quick. So it is dry and ready for me to look at. So this is the one where I'll be going down all the way to my 100 times magnification with oil. So I'm gonna
I think I have like certain.
go up here, center my slide.
I tried deep cleaning it, and then I was like, am I making my scratch? I feel like I might be making more, so just it's stuck. I don't think this makes out. I've like taken them apart. I took the lens and I have all parts out. I took the lens. But obviously at this point, like we've all done what we could. But I don't know. Chris came in and temporarily.
My 40. And so this is not mineral oil, it's immersion oil for my 100 times. Just a single little drop there. Scrolling further. So this is definitely where I'd be looking for things like bacteria or yeast or anything that is abnormal on this slide. In this case, once again, his ears are actually pretty clean. I see some basic debris, a couple of small areas that look like just cells, skin cells, epithelial cells. Really nothing that looks that exciting on here at all. So he must have something else going on that's making his ears so itchy, like fleas or some other kind of a skin issue, maybe even a skin infection on the sides of his head. Because usually, I mean, I'm going to scan this slide thoroughly, but we're not going to film all of that. But usually, especially if they have a really bad ear infection, things like yeast and stuff like that kind of jump right out to you. In this case, there's really not many cells and much debris on this slide. So we're going to do our skin scraping. So I have my materials up here. I have my mineral oil, my clean slides, and my blade. What we do skin scraping is usually for animals that have visible lesions or overly itchy. So you're looking for things like scabies or demodex. There is superficial and deep skin scraping. Superficial, you're looking for Chyletiella and scabies. In a deep skin scraping, you're looking for demodex because they live in the hair follicles. So you're going to be squeezing as you're getting your sample to try to encourage them to come to the surface. So you can see them on your sampling slide. So we're going to pre-treat our little slides here with a little mineral oil, as well as my blade itself. Thank you. A little mineral oil. So when you're doing a superficial, this is my patient right here. He's got a little lesion on his back right here that has been popping up in a couple places. This is where the one has lately. Don't seem to be overly itchy, but we're just going to give it a scrape to make sure we don't see anything else that's going on. So you always want to go in the direction of the hair itself. When you're doing a superficial, you're just more lightly pulling off the top. You're getting little bits of hair. Sometimes you're getting a little bit of actual scabs and things like that. And then wipe it into my oil slab. Use the first one here for my more superficial. And when you're doing a deep, you're going to want to squeeze the area while you're scraping to encourage, like we said, the stuff comes to the surface. And you want to scrape with the direction of the hair until you see a capillary response. In other words, a little bit of blood at the top of the skin. So you can see my little bit of blood forming on the top of my skin, which means I'm getting down through the first skin layer and I'm squeezing as I'm scraping so that we can encourage anything to come to the surface. There we go, that's good. You can see my material on my blade itself. And once again, we're going to put that in our mineral oil, so that's probably going to be our most diagnostic slide right there in the middle. This is my sharps container, and we'll go evaluate it under the microscope. So I'm going to microscopically evaluate my skin scraping slide that's on oil here. So we're going to start at just 4x. Let me just center my slide here before I start looking. Looking mostly on 10x and maybe 40x. It should be visual at that point. There we go. Now I'm on 10x. So first and foremost, unsurprisingly, what I see is some hair follicles, including the root, but that's to be expected, especially when you do a deep skin scraping because you're going to pull out some hairs. I see some epithelial cells and some just normal debris. Maybe a couple of it's just really just debris. So I'm not seeing any signs of any scabies or mites or anything that is abnormal in this.